Have you ever heard of peptic ulcer? Ulcer is a specific term used to describe the erosion of the tissue that causes by the acidic environment of the stomach. As a whole, peptic ulcers are related to the corrosive action of pepsin and hydrochloric acid on the mucosal lining of the lower esophagus, stomach, and first part of duodenum. The most common causes of peptic ulcers are infection with the bacterium Helicobacter pylori and long-term use of non-steroidal anti-inflammatory drugs such as aspirin and others. Let's understand how can H. pylori survive in the stomach and causes peptic ulcer. This is simply because the bacteria secrete urease enzyme that produce ammonia to neutralize the acid, allowing them to survive. The H. pylori secrete protease and lipase enzyme to degrade the mucosal layer. This allows the acid to cause damage to the epithelial cell, and this will result in cell injury. Now, let's understand how NSAID can lead to peptic ulcer. NSAIDs such as aspirin are reversible inhibitors to COX-1 enzyme that are important for prostaglandin synthesis. As a result, this will lead to a decrease in gastric protection due to a decrease in epithelial mucus, bicarbonate secretion, and mucosal blood flow. Lowering the protective mechanism of the mucosal lining can increase the incidence of injury. In addition, you might have increased in the risk of getting peptic ulcer if you smoke, drink alcohol, stress, or genetic predisposition. Most patients with peptic ulcer present with abdominal discomfort and dull pain. The pain is located in the epigastrium as this structure is developed from the foregut. Other symptoms and signs of peptic ulcer are blood in stool, heartburn, and nausea. However, these symptoms are not specific. To diagnose peptic ulcer, the doctor will order several tests, such as X-ray, laboratory tests for H. pylori, and an endoscopy. The main goals of management and treatment is to improve the quality of life for patients. How to prevent and manage peptic ulcer? This management and prevention include wash your hands, limit the use of NSAID, and quit smoking. However, these are not the main form of treatment. The main form are medication. For example, histamine blockers, they prevent acid production. Acid pump inhibitors are stronger than H2 blockers, but they work by stopping the pump secreting acid into the stomach. And antibiotics, they will kill the H. pylori if it's present. These are the most common drugs prescribed to patients with peptic ulcer. If the treatment fails, the patient have an option to get surgical intervention. Stay informed. If you want more information, click the link below or consult with your doctor. Thank you.